I mean, I really just think it's that sense of alienation and being apart and desperately wanting to be. I always used to say to my wife, Madeline, I just want to be normal. And she'd say, well, what's that, Howard? And I said, well, you and everybody else. And she'd go, well, you're joking, aren't you? I'd say, no, I'm not kidding at all.
As a younger person, as a younger male, I found it very, very difficult. It wasn't something that I learnt. My father was a stockman and a few, like I say, never really talked about feelings, in the footy club, all that sort of stuff. I never saw anyone cry or anything like that. So I found it very difficult to open up to people, or even how to have that conversation, how to start it.
I find it very tough to talk about because of losing my own son to suicide. Knowing how hard it is for those around me, I feel embarrassed about having attempted to take my own life. I've tried twice. The first time, nobody but my husband and a couple of neighbours who helped him get me to the hospital knew about it. But when I saw the neighbours a week later, they made me feel like a leper.
It can be hard at the first start. It can be extremely daunting, frightening. It's a whole new world that you don't think you're ever going to endure in your life. It's scary, it's dark. You think the world's going to end and there's no way out. And just that whole word suicide is just so scary.
Generally, this is not easy to talk about. In the past, I've felt health professionals haven't taken my concerns seriously.
You've got to understand too, you may have a genetic predisposition to this stuff, okay? You're born with a vulnerability. It doesn't mean you're subhuman. It doesn't mean there's anything wrong with you. There's nothing to feel ashamed about. You've got no choice. I don't remember ever queuing up and saying, well, Howard, what sort of personality would you like? You want to be an extrovert, introvert, and you want to feel good about yourself or maybe not so. I didn't get that choice and I don't believe anybody else
Things
did.
that make it harder are sometimes situational. So not so much crisis, but that does have an effect as well. But as things come along, so it's been a few months now since I lost my mum. So there's a lot of high emotions. So skills that or protective factors that worked previously, I've got to work really, really hard so it doesn't spiral a bit out of control. So, just because I've spoken or tried these things before doesn't mean they're going to work every single time.
For me, I didn't see mine coming. Mine was completely out of the blue. Mine ended up being a trigger that took me to that point, and that is all it took for me to go, I'm done. There was no coming back. My rationale was gone. I could not turn back. Leading up to that point, with my work as a frontline, as an remote ambulance officer, I see a lot. And in those rural and remote towns, you get to know the communities. And unfortunately, we had lost a few in the town in a short period of time, and I got to know them. And unfortunately, it impacted me, and I didn't realise.
And probably feeling alone. Like everything, you think you're the only one going through it, but there could be 10 people in town going through the same thing. But you don't have that, probably because of stigma and people not wanting to share, and are you part of that group kind of thing. So
look, loneliness is it's just a heinous part of the human journey. It's just terrible. You can't explain it to people because a lot of people spend a lot of time on their own, but acute loneliness, it's, in my experience, it's right up there with my diagnosed mental health issues, and it just hurts a heck of a lot, because it's really sort of encapsulated within poor feelings about yourself. So you're not out there, you're not mixing with the community. Why would you do that if you felt pretty good about yourself? You don't.
It was only when I began engaging in deliberate self-harm that I felt I was listened to, which is interesting because that self-harm was a very effective coping mechanism at getting through those suicidal impulses. And in effect, I was in need of less support.
It is a confluence of those two extremes. It's just this unbelievable sadness that I go, okay, well, this is what's happened, Howard. This is what it's come down to. I'm overwhelmed. I can't relate to modern society. I probably never could.
That's also a worry to turn up to an ED. Worry about, is this the time I'm going to get retrieved to Adelaide to be put in rural and remote? And even though that the likelihood of that is fairly low, that is a barrier to actually accessing some services because of past experiences. You know, these things escalate quickly. If I say something wrong, if I tell them too much, not enough, all of these sorts of things, they're the battles that are happening internally, and all they're asking you is, are you okay?
All the big helpful services, 100 kilometres or so away, like in Clare or Port Pirie or Port Augusta, there are a few services around, but they're not widely known how to get into them.
Like for me in Cuba, they say our locals are Port Augusta, and that's 580 k's away.
Living in, this is an outback, isolated outback town, you know, 110k that way, you know, and it's 128 down to sort of Elliston, you know, but we're trying to live a city lifestyle, you know.
I think it was last year when I asked my doctor, there was only 2 mental health nurses who covered the area, or like between Peterborough, Clare, Wilmington, all that space. There's only 2. So yeah, it's grim out here.
The closest regional hospital for mental health support is over 150 kilometres away, but the administrators don't look at that. They just put you in a zone and that's where they send you. I was lucky and my doctor managed to get me released to go home on the grounds that if they sent me to the hospital that they were going to send me to, I wouldn't have had any of my support network to help me.
Just even getting a local GP is hard, and having that continual care is just so hard because we have locums two weeks in, 2 weeks out. It's never a consistent care of the same doctors all the time, and for always having to repeatedly tell your story. That is a major disadvantage to us country folks because we cannot get doctors and nurses to be in our hospitals and to stay in country.
Talk about tyranny of distance and the like, and again, my experience is that we have really good clinicians, whether they be nurses, whether they be, you know, we do have like locum doctors and all that sort of stuff. So there's always there's no continuity of care, but the people we get are good.
Community, the community contact, close-knit, everyone looks out for each other. That is an advantage. And like I noticed when I came home from hospital, while I was still in that early stage of my recovery, if people hadn't seen me around town, I had a couple of people just turn up and just knock on my door just to make sure that I was okay, because they hadn't seen me around town or hadn't heard from me.
I know if I said I was struggling on, you know, whatever it is, you know, there'd be people that would, you know, jump at helping you and all that sort of stuff. And I think, you know, if you're in Adelaide, you might not have that community.
There's only a couple of farmers who I know of who actually do talk about it. The rest, they just get on with it. My brother's a farmhand, and I keep saying to him, you need to talk to somebody. And he says, well, if I don't work, I don't get paid. And it was like, mate, make time for your health before it gets on top of you.
And employers, you know, are going to need to be a little more sort of, you know, they're going to have to come to the table a bit more. You know, if an employee says, no, look, I just can't make it today, you know, and if you don't have a formal mental health day owing, well, you're going to have to work out some sort of an arrangement, a give and take. Maybe you can make it up a bit later. So
Cuba is such a ageing community. It needs a lot of input, a lot of funding.
Service delivery, yes, running side by side with community, but be a realist, folks, about the fact that we're not going to have every service, you know. We've got to do the hard yards. The shoulder to the wheel's really got to be on behalf of the community.
Don't be afraid. There's no shame in putting a hand up and going, hey, I need help. It is okay not to be okay. I've learned that massively.
And reach out early. Because we all sort of let it fester and build up, and then all of a sudden the thing that normally tips you up is the tiniest little thing, but it's already had 20 things already line up. And then
with the mental health aspect, if you go to a doctor, talk to them, all right? They're there to help you. They're working for you. So don't say, yeah, I'm fine, if you're not. Say what's going on. And if you don't like what the doctor says, feel free to get a second opinion.
If you can't talk to your family about it, you've got to love them anyway, okay? Because they just can't deal with it because you're very close to them, okay? It's not that they don't like you, it's not that they don't care, but then you've immediately got to go somewhere else and get the support that you're not being able to get from your family, okay? Your friends, your community in general, you know, your local health services, they all had, basically a lot of them have health after hours.
So knowing, when I'm at this level, well then, it might be friends, might be family, but this might be time to go and see your clinician, your doctor, whoever it is. Yeah, so know who those supports are, reach out early, know your triggers. If you are on medication, know what your medication is and what's it doing. So why is that important? So
there's a Midnight Oil song, and there's just one line that says, I just want to touch somebody. That's it. I just want to touch another human person. And there's too many days where it doesn't happen, and I believe there's too many days where it doesn't happen to a whole lot of people. And when it does, it lights you up. It lights you up like a festoon Christmas tree. Just boom, you just come on. It's not going to be driven by government. It's not going to be driven by academia. They've got a really valuable role to play. It's not going to be driven by some policy think tank. It's going to be driven and accommodated and owned by people in the street, because that's the people that it's happening to. It's common sense. You've got to take ownership of it, community. I mean, this is it. This is a challenge, but it's not an aggressive challenge. It's a heartfelt plea. Please take ownership.